Welcome to another edition of Health Check 360, brought to you by Toma Health. We have Toma Health clinical exercise physiologist Anna Wargowsky with us to talk New Year's resolutions regarding cardiac health. Anna, welcome to the Links. Great to have you.
Yes, thank you for having me.
So cardiac health, what's cardiac health and cardiac rehab? Can you just kind of explain that?
Yeah, so cardiac rehab, it's an outpatient program. It's individualized, and basically the patients will exercise, and we have them do some education too. So it's a supervised program. So we're watching their heart rhythm, their heart rate, their blood pressures. So it's in a very safe and controlled environment for them to exercise in. And we really get to know the patients really well because we see them anywhere from 18 sessions up to 36. So depending on what they would benefit from. So sometimes we see them up to 3 months. So you really get to see that patient grow and get stronger and improve their level of fitness. So it's very rewarding to see that.
So who's participating in the rehab, for the cardiac rehab?
So a lot of different patients will benefit from it, but specifically patients who have had a heart attack, have had heart surgery, valve surgery, they might have heart failure, they might have stable angina, or even a heart transplant. So really it's a pretty serious population we're working with, but all ages can benefit from it. But really we see those patients who have had one of those events happen to them, and the provider or cardiologist will send us that referral. So usually it's self-referred from them. So the patients, if they ever have any questions, though, if you would qualify, is just to ask your provider and see if they would benefit from it.
So it sounds like a very personalized rehab as well. You're really meeting the needs of that patient when you're doing cardiac health. And anything with the heart is so important.
Yes, definitely.
Okay.
Very important.
So let's talk a little bit about New Year's resolutions, right? So a lot of people have that on their, a lot of it's weight loss and getting physically fit. Can you talk a little bit about, or tips for New Year's resolutions for our viewers?
Definitely. So like in cardiac rehab, we want them to develop goals, and we're working on behavior change modification. So right now it's New Year's approaching, and people are setting those goals and starting to think ahead. And a lot of times,
when you say behavior modification changes, so that sounds pretty big. Like that sounds a little daunting, doesn't it? So okay, explain that just a little bit more.
Yeah, so you want to make the behavior change SMART. You want to make a SMART goal.
Okay.
That's an acronym we use. It stands for specific, measurable, attainable, realistic, and timely. So if you have those things developed, then the patient will be able to set SMART goals and achieve those goals more realistically than a broad goal like, I want to lose weight, I want to exercise. Those are great intentions, but they lack the requirements to make them a SMART goal.
Right, so then you'd feel more successful if you really had it more. It sounds like it's more planned out.
Yes. Yeah. So like an example of a SMART goal could be, I want to go to the gym this month 3 times a week for 30 minutes at 7 p.m. Now that's a SMART goal because you're telling yourself you're going to go to the gym, you're going to go at 7 p.m. and you're going to be there for 30 minutes. So that's attainable, and the next month maybe you can bounce off of that and go to the gym maybe 5 times a week for 30 minutes at 7 p.m. Ultimately, you want to have an end goal, though, like maybe this spring you want to do a 5K with your best friend.
Okay.
So you want to have something that you want to achieve at the end, but set little goals along the way that will allow you to reach that goal.
Great. So before we've got about a minute left, if our viewers want any more information about the cardiac rehab or just even heart health and things like that, where could our viewers find more information, Anna?
Yeah, they can go to tomahealth.org. That's a great resource with all cardiac rehab. Explain it a little bit more in depth. So they can go to that, and a lot of education on there as well too. So that's a great resource for people to go.
Thank you for joining us, and I love the SMART goal ideas. Sounds very attainable.
Thank you.
Well, thanks for joining us.